So, Dr. Vivek, many of our patients ask us that are stones hereditary?
Reduced water intake, and the foods that we have, those are oxalate rich foods, sodium rich foods, so those contribute to stone formation.
Let us talk a little bit about the pain that occurs so people can recognize it.
So if a stone gets stuck, naturally it can cause back pressure on the kidney, and that causes pain. The patient can land up in dialysis. Fortunately, we have two kidneys, so one kidney, even if one kidney is very good and functional, a patient can survive his entire
But
life.
still, to lose one kidney is a very bad
Very
thing.
bad.
Very bad.
Very
thing.
bad.
Yeah. Does alcohol play any role in causing or preventing or anything like that? Welcome to Prime Talks. I am Dr. Hrushikesh Vaidya, Medical Director of Horizon Group of Hospitals. And today, we are going to have a special guest, Dr. Vivek Jadhav, who is a urologist, and he is going to bust myths about kidney stones. Welcome, Dr. Jadhav.
Hello, sir.
So, kidney stones being extremely common, there are a lot of questions in our patients' minds
Yes.
on a lot of things on how the stones are caused,
Yeah.
what can be done to prevent,
Correct.
and how are they treated. So, please enlighten us today on those points.
So, Dr. Vaidya, kidney stones are pretty common, particularly in the Mumbai and suburban region. I would say 1 in 10 individual may
Okay.
have kidney stone in this area. So, it is that common. Uh, Talking about the causes, it can be hereditary, but more of related to lifestyle and your diet. So,
Okay.
those play a very important role in kidney stone.
Many of the patients, what I see, are asymptomatic
Yes.
with the kidney stones.
Yes.
And they are routinely detected on, I believe, sonography.
Yes.
Is that right?
Yes.
But they can be a problem if they are not addressed. Is that
Yes.
right?
Yes, very
Can-
true. So, kidney stones, unless they are lying in some corner of the kidney, they can go unnoticed for years together.
Okay.
So, that is a very common scenario. So, individuals undergoing health checkups for various reasons, they can get incidentally diagnosed on sonographies with kidney stones.
Okay.
If a stone dislodges from the kidney and it gets stuck in the tube which drains the kidney, so that tube is known as ureter. So, if a stone gets stuck, naturally it can cause back pressure on the kidney, and that causes pain.
So, most patients present with pain as a symptom of kidney stone.
Now, yes, sir.
Can you elaborate on the type of pain and how severe it is and what usually presents?
Right, right. So, I'll discuss a scenario which I had just last month. So, there was a couple who had come to me. So, the wife had a severe excruciating pain. She described the pain as ये तो labor pain से भी ज़्यादा pain है, इतना pain मुझे कभी नहीं हुआ. So, she had a 4 mm stone, small stone stuck in the tube which drains the kidney. So, that was the cause of her pain. And it was a small tiny 4 mm stone, so I told her that with some medications it may pass off. The husband also shows his report कि सर मेरा एक हेल्थ चेकअप हुआ था, उसमें ये आप देख लीजिए, मैं आया हूँ तो साथ में दिखा देता हूँ. So he had a 20 mm stone in the kidney, 2 centimeter stone in the kidney.
So much larger.
Much larger. It was still stuck at the junction of the kidney and the ureter. It was causing back pressure changes on the kidney, but still he did not have
No
any
pain.
pain.
Right.
So the symptoms vary largely. So this 4 mm stone of the wife will be treated medically by me. There is a 90% chance this will pass off with medications alone. And this guy who has a 20 mm stone, he will probably need surgery for the
Right.
same. So symptoms are different.
Let us talk a little bit about the pain that occurs so people can recognize it.
Yeah.
So usually the stone pain starts in the lower abdomen, is that right?
Yeah, it starts usually in the flank region.
In the
but
back side.
In the back side.
Okay.
So the pain, the site of the pain varies as per the location of the stone.
Okay.
Because it is usually a referred pain.
Hmm.
The localized pain occurs because of the distension of the PC system, that means the kidney. So that causes the local pain in the flank, but it may occur appearing as if it's in the lower abdomen.
Lower abdomen.
It may sometimes go to the thigh also. It may sometimes happen that patients may feel that there's a pain in the genital area also.
Genital, scrotal area.
Yes, yes.
Yeah.
So those can be varied symptoms of kidney stones. So sonography is the easiest way to diagnose kidney stones. So there's no radiation in the sonography. So it's a basic screening methodology.
That's right.
So if we need to attend the stones in a better way, or we need to get additional information, or we are planning some surgical treatment, then we undergo a CT scan.
So, Dr. Vivek, Many of our patients ask us that are stones hereditary
Hmm.
and who's at risk. Sometimes patient develop stones and then they wonder why they developed it. Why me?
Why me? Correct.
So
Yeah,
there's
that's the
always this
question.
question of why me. So
Why
can
me?
you enlighten us a little bit
Yeah.
about
So
the
hereditary,
causes?
yes,
Hmm.
hereditary causes definitely play a factor, but more than hereditary, I would say it is the lifestyle that matters.
Lifestyle.
Yes.
Hmm.
So the sedentary lifestyle, reduced water intake, and the foods that we have, those are oxalate-rich foods, sodium-rich foods. So those contribute to stone formation.
Is there any relationship with sedentary lifestyle and lack of exercise and things like that?
Yes. So sedentary lifestyle basically contributes to raised blood sugars,
Okay.
and raised blood sugars and diabetes in a complex mechanism contributes to infection.
Yeah.
It can contribute to uric acid deposition also. So by a complex mechanism, these patients are always prone to stone formation.
Now, one question that comes frequently patients ask is how much water is enough?
Yes. So water is the most important medication, I would say, to prevent kidney stones.
Very good.
Whenever you are talking about prevention of kidney stones, your 90% focus should be on the quantity of water.
Okay.
So there's no specific quantity which anyone can describe, but
Hmm.
by and large, if we say we are awake for 12 hours a day, if someone drinks 1 glass of water per hour, that makes up to 12 to 15 glasses in a day. That is more than enough. So it counts to around 2.5 to 3 liters of water for prevention in a normal individual who doesn't have any cardiac risk, who doesn't
Cardiac
have
risk.
any chronic kidney disease, who doesn't have any failing heart. So for those in whom there is no water restriction, 3 liters of water.
Another question, very important from prevention standpoint. Does alcohol play any role in causing or preventing or anything like that?
Yeah, so there's a lot of myth about alcohol. If you see, the friends keep on saying, "Arey beer pee le,
That's
stone
right.
nikal jayega."
There is a
So that's a common
huh.
myth. So see, beer or any alcohol is a diuretic.
Okay.
So when the stone gets stuck, or if we want to flush off the stones from the kidney, naturally we will prescribe diuretics, but that's in a limited dose and limited indications.
Okay.
So it's not that suppose someone is addicted to beer and he's consuming a lot of beer almost twice a week or so. So the oxalate content of the beer is so high that this beer will again cause stones in him. So one more scenario I will tell you.
Hmm.
So last week a patient had come to me with his family, and he was so frustrated. Since 4 years he had been having kidney stones on and off. So whenever the stone used to get stuck, he used to have pain as usual. So he came to me, sir, कुछ तो बताओ, बार बार स्टोन्स होते रहते हैं, कुछ तो इसका रेमेडी बताओ मुझे,
Okay.
कंफर्म कुछ तो
Hmm.
बताओ.
Hmm.
So I asked him about his lifestyle, about his diet. Now ये बंदा जो है, he is a corporate worker, corporate employee, and he just doesn't drink water. On asking questions, he told me कि दिन में hardly 1 लीटर पानी पीना होता है. Now he's asking about me about the prevention. उसके घर पे उसने वाइफ और माँ को काम पे लगा दिया है. They remove all the seeds from the tomatoes, from the
Okay.
bindi,
Hmm.
from the
To reduce the
to
stone.
reduce the oxalate content. That is true. Seeds contribute more to oxalate, but it is not that you can avoid drinking water and remove seeds.
Okay.
So, as I said, 80% or 90% of focus when you talk about prevention should be on quantity of water.
Quantity of water. So that's
So,
the easiest thing you
That's
can
the
do.
easiest thing that can be done. ऐसा
From
नहीं कि आप
prevention.
seeds निकालते बैठो, दिन भर वही काम करते बैठो, and you don't drink water.
Okay.
That doesn't have a point.
So, Dr. Vivek, as you pointed out in one of your patients that there was a large stone and it was causing back pressure changes. Now,
Yes.
let us tell our viewers that the back pressure changes that you're talking about can be really a problem,
Yes.
right? I mean, they can cause the chronic kidney damage.
Yes.
Can you elaborate on that?
Yes. So, when a stone gets stuck in the tube, suppose the drainage of the kidney is hampered, naturally it causes back pressure on the kidney because the outlet is obstructed. So, the pressure on the kidney compresses the functioning part of the kidney, that is the parenchyma, that is the mass of the kidney.
Which is very sensitive.
Yes, which is very sensitive. So, chronic back pressure changes on the kidney will thin out the kidney.
Okay.
Once the kidney is thinned out, it cannot regain.
So that's a very, very bad complication of a stone,
Yes.
which we see often actually.
Very true, very true. So such stones can go silent for years together.
That's right.
So there may be patients who don't develop any symptom at all. They may be completely asymptomatic with a stone sitting right at the junction of the kidney and the ureter, and the kidney getting completely fired, being a non-functioning kidney over a
and
period
which is
of
a very
years.
sad part, that the
Sad part to have.
patient will lose renal function
Yes.
and eventually can go on dialysis.
Yes.
Is
So
that right?
if this happens with both
Both
kidneys,
kidneys it can.
the patient can land up in dialysis. Fortunately, we have two kidneys. So one kidney, even if one kidney is very good and functional, a patient can survive his entire
But
life.
still, to lose one kidney is a very bad
Very
thing.
bad to
Very
have,
bad
very
thing.
bad to
Yeah. Now another complication of a stone is the obstruction and infection,
Correct.
which can be also very life threatening.
Very true. Very
So
true.
can you elaborate on that?
So infections in the kidney occur when the stone gets stuck in the ureter, or the tube gets shrunken, causing some stricture in the ureter. So naturally, if any outflow is blocked, there will be stagnation of urine within the kidney.
So there is stagnation.
Correct. So
Okay.
this stagnation causes infection. So it's like a water tank. If you don't empty a water tank, you will have some deposits in it. So likewise in the kidney, infection gets deposited.
Okay.
Now this infection, if it spreads so overall in the body, it is called urosepsis. And urosepsis is really bad.
Very life threatening.
It can be life threatening. So back pressure on the kidney and infection, these are two dreadful situations where we need to intervene early.
Now going to the treatment part of stones, many people have the first question: Can this be medically treated? Can you give us medicine and dissolve the stone?
Dissolve the stones.
So I guess that's not possible, right? To dissolve the stones is not possible.
So it is possible only in certain indications. 90% of the stones are oxalate stones. So these are very hard stones. These are as hard as you find on the roadside. So if
they are like real stones.
They are real stones. So even if you pour acid on those stones, they are not going to melt.
Okay.
How can you expect a stone within the body taking some medication getting dissolved?
So it's not possible.
It's not possible, frankly. So oxalate stones cannot be dissolved. It is just the uric acid stones that can be dissolved. Now, sadly, uric acid stones are only in 10% of the population.
Okay.
90% are oxalate stones, as I said.
Okay.
So stones, oxalate stones, they can be expelled out. If they are tiny in size, they can flow down through the ureter and come out. So there are certain medications which can help expelling the stones out.
Okay.
So that is what we give when there are small stones in the kidney or in the ureter.
But most of the treatment is procedural or surgical. Is that right?
So if the stones are larger in size, say more than 8-9 mm or more than a centimeter, we know that these stones are less likely to pass off. Or if the stone is causing obstruction for a longer period of time, it is hampering the kidney function, or it is causing significant back pressure or infection in the kidney, then we have to take the stones out.
Okay. I think the medical field has evolved quite high. Significantly. Yes. And there are a lot of treatment modalities where you are not required to make any surgical incisions, cuts and things like that.
True.
And I think you are doing a lot of your work endoscopically.
Correct.
Without making any incisions.
Yes.
So can you tell us about that, how the field has evolved over the years?
Yes. So open surgery is practically outdated these days.
So no open surgery. Very unlikely somebody
no
may
open
need
surgeries for kidney stones. It is done through telescopic method, which we call cystoscopy, ureteroscopy, or nephroscopy. So wherever the stones are, we try to reach percutaneously or through the normal urinary passage. We fragment the stone using laser and we take the stones out. This is how it usually goes.
So Dr. Vivek, there is a lot of buzz about laser treatment nowadays.
Yes.
And it is quite exciting field of medicine where laser can be used for patient care.
Correct.
And I guess you have brought us to show what exactly, how you use the laser.
Yes.
So can you enlighten us on that?
Yes. So basically laser is a small fiber. So this is how a laser fiber looks like. So this is so thin.
Such a thin fiber. I think it's
such a thin fiber.
Yeah.
So this laser fiber is attached to a machine and it's under my control. There's a foot switch. So I can control the energy. I can control the frequency with which this laser fiber can be used to fragment the stones and powder the stones.
So essentially what you're saying is that this laser, that small piece of fiber,
yes,
goes
It goes
into
through
the
the telescope,
telescope.
and under vision we powder the stone or fragment the stone
So
as
the
per our
energy is
requirement.
delivered to the stone
Stone.
and the stone gets fragmented.
Correct, correct.
And can you show us
So
the
this
scope?
is how the telescopes are. So these are such thin telescopes these days.
So
So these go through the normal urinary passage. So there are no cuts or scars.
exactly.
Happens under anesthesia very comfortably. So this goes through the normal
So
urinary passage into the kidney, and the scope is, as you can see, is very flexible. So it can hover into any part of the kidney, and all of the stones in the kidney can be taken care of in one go.
and there are no external cuts.
No external cuts or scars. So this is a very popular surgery these days. We call it RIRS, that is retrograde intrarenal surgery. That means
RIRS.
RIRS. So retrograde माने नीचे से जाते हैं. So retrogradely we go into the kidney and powder the stone. So this is how it
So
goes.
science and technology has advanced so much
Yes.
that previously when they had to, I remember when I was a medical student, they had to open the kidney
Yes.
and remove the stone and then suture it back.
Correct.
Such a big incision.
Yes.
Now we don't do that anymore.
No. We don't do that
and
anymore.
and it has become almost like a daycare procedure.
It's a daycare
It
procedure.
is a daycare
It
procedure.
is a daycare
Wonderful.
procedure.
So the science had advanced, and with these modalities we can prevent the stones from causing further complications such as kidney failure,
Very true.
such as infections,
Yes.
urosepsis,
Yes.
and things like that.
Yes.
So very interesting that the science has advanced for the benefit of
The mankind.
patients and
Yes.
mankind and humanity.
Very true.
So very nice. And generally, do you require general anesthesia for this?
So it depends on the choice of the patient. We give choice to the patient. There are certain patients who are comfortable or indicated only for spinal anesthesia. So we give a regional anesthesia. That means the lower half of the body is anesthetized. Patient is comfortable talking to us.
Okay.
Or if the patient is scared of such anesthesia, we give general anesthesia. Patient is put to sleep,
Put
and
to
then we
sleep.
do the procedure.
But the patient definitely doesn't feel anything
no,
during
not
the
at all.
procedure.
Since there are no external cuts or
of
scars.
course, of course.
So it's a
But
just
there is
come in
always
and
this
go.
anxiety when they undergo procedure.
Yes.
Whether I am going to get hurt during the procedure. The answer to that is no.
No.
So it is
So
no.
there is a myth that laser damages the kidney. So if it's done in expert hands, if it's done carefully, this laser doesn't
Cannot
have the capability to damage the kidney.
So it's a very safe
It's
procedure.
a very safe procedure.
It is, I would say, a painless procedure for the patient because
Yes.
we give anesthesia
Yes.
during some sort of anesthesia.
Yes.
And it is a very become a very popular
And
modality,
sophisticated
modality for the patients. So very nice introduction to the laser concept for our viewers. Thank you. So let's go to rapid fire.
Yes.
Stone pain, always severe.
Not really.
Stone equals surgery.
Not at all. Smaller stones can pass off.
Is laser safe?
Very safe.
Very safe. Are stones preventable?
Yes, definitely.
Is laser surgery able to be performed in all ages?
Yes, it is optimum for all age groups.
Do stones always recur once you have it?
So once a patient has a stone, there is a 50% possibility that he may again have a stone.
Okay.
So if not taken proper care of, and if he is not following the advices, then stones definitely can recur.
So I think it would be very important to drink plenty of water prevention wise.
Yes.
And then keep on screening with ultrasound so often so that
Yes.
it can be picked up early. I
Yes.
think those two things would be important, right?
Yes. For all stones formers, it is general advice that once in a year at least
Once in a
they
year.
have to undergo a sonography.
Sonography to see what the stone status is.
Yes.
I think that would really save a lot of trouble for the patient.
Correct.
Can you give our viewers some take-home message for stone prevention and treatment?
Yes. So the most important take-home message is to drink plenty of water. If you are not a kidney disease patient or if you don't have any heart problems, 3 liters of water in a day divided throughout the day should be adequate enough. Secondly, if you are a stone former, it is a wise idea to do an ultrasound every year to check what is the status of the stone. These two things I would say should be the take-home message.
So thank you, Dr. Vivek, for a very informative session for us and our viewers, and hope to see you again in Prime Talks.